to our YouTube channel. This is Angel of Team Zulueta. If you're just new to our channel, don't forget to like, subscribe, and hit the notification bell for future videos! Yay! Ayan, very lively, diba? In this vlog, we will be discussing the common interview questions that are being asked when you apply for a job in the perioperative department. And to help me discuss these questions, I have a special guest. This is my friend. Let's all welcome John. John, where are you working?
I work in the cardiac catheterization laboratory here in Australia, which is part of the perioperative environment.
Yes, that's why we knew each other.
That's right.
From cath lab, if they will fail, in their operation, we will do it in the cardiac surgery department.
That's always what you say to me. That I'm doing okay, isn't it?
True.
Yeah.
So John, how are you? Before we will start, syempre, welcome to Tony Talks.
Well, you just extract me out of the lab. I've finished work now. Doing great, actually. We did a lot of cases today, so you have not received any from us, so we've done our best.
Tissue tayo. Aka-nosebleed si John pag nag-i-English. Okay, dahil magaling naman siya mag-English, gamitin natin, di ba? Kaya siya ang pinili ko na mag-answer ng mga questions para may makuha kayong mga tips. Sana lang naman may sagot ito ng matino sa mga questions natin, di ba?
Well, it's been a long time since I was interviewed in a position.
Okay.
So,
you can do it.
Go.
Okay, just pretend it's your first time again. Alright, so John, can you tell us what's the process of the interview?
According to my experience being interviewed, it comes in 3 stages. The first stage would be how you describe yourself. The second stage would be in the clinical role. They're going to ask you some question, and then you're going a clinical question, and then you will respond to that clinical question. And number 3 is more like the how will you work in an environment together with colleagues. So the first stage would be, of course, you need to sell yourself. So
we'll go for the first stage first. First stage, as you have mentioned, it's all about yourself.
It's about myself.
Okay, I'm the interviewer. Can you tell me something about yourself?
Yeah, so I worked in a cardiac catheterization laboratory for, I don't know how many years now, but it's been a long time. Yeah, so my experience is basically being a cath lab nurse, so I assist in interventional cardiology, interventional cardiology being angiogram, angioplasties, and I specialize in transcatheter aortic valve implantation nursing, wherein there's that part of the team that we implant aortic valve minimally invasively, not surgical open. So I'm part of that team, and also being a clinical nurse specialist, I have the role of doing all the qualities in the cardiac cath lab, doing some audits, interpreting the audits, and submitting the audits to the audit manager. So that's part of the role. That's part of my role.
Yeah, so see kung paano niya binenta yung sarili niya. Kumbaga, the experience, yung parang short yung kanyang answer, but you will be able to determine if this guy is an experienced one or not, diba? In that first question pa lang, you should be able to tell the employer all of the specialties that you've been doing ever since you've started being a scrub scout in the operating theater. Okay? And then if you have a position as well, just like John, for example, just like us, wow. So clinical nurse specialist, you should also tell them about it, that what are you doing about it, what did you do, what are your projects, tell everything. Parang ganun, umpisa pa lang, ooh.
Well, maybe it's in your resume, but it's that's what they ask anyhow. And build yourself, sell yourself.
Correct.
During that first stage. And that first stage, I mean, selling yourself, telling about yourself, that makes the interview a lot more easier.
Correct.
And cozy.
Yeah.
You get to feel the environment.
Just start talking. Start
talking. Start smooth. That's it.
That's it. If you will not talk, they will think, she doesn't know anything, or he doesn't know anything. Okay. What do you know about the hospital?
Well, the mission and vision of the hospital is really important because you need to know where you're at and what the expectation of the hospital if you're applying for that position. So certainly you need to have a bit of light breathing with those matter before applying to job, and you're expected to know that before you subject yourself to the interview.
Correct. And also, it will also help if you would know the bed capacity, for example. If you're applying as a scrub scout, for example, the specialties that you have in that particular hospital. You should know what are the operations that being done. Yeah. Next question, under stage 1, about selling yourself. What are your weaknesses and your strength?
Of course, you need to say a lot of your strength, and that would involve, of course, a lot of your skills and your knowledge with the job that you're applying. As for me, being a cath lab nurse, my skills would be ECGs. They are my bread and butter. Also, because I do cardiac taking and hemodynamics as well, and so I can sell that being my strength. And also, so mainly all the knowledge that you have incurred and all the things that you think are positive about yourself. Weaknesses, you don't really tell like I am late for a job. No, you don't say that. You say a weakness that could be positive.
Correct.
Yeah, so for example, when I was interviewed, I said, I am obsessive compulsive with things that tend to affect my time.
Yes.
But in reality, the obsessive compulsiveness is needed because you are dealing with highly technical equipment and also highly technical role in the lab, and that obsessive compulsiveness is a negative but positive in a way.
So strength, you know that already. For example, you are accountable, you have a good attitude, you know how to manage your time. Yeah, all of those things. And then negative, the weaknesses, as John.
The weakness that serves as positive.
Yes. Next question, how would you describe an accountable nurse?
An accountable nurse, you need to own your experience. And for example, in a situation where if you are doing a transcatheter aortic valve implantation and you, for example, miscalculated the measurement or miscalculated the load, and being an experienced nurse, you need to say that you miscalculated or you misjudged things, and you need to own your action so that it will not compromise the situation or to help the patient. So you need to declare it
right away.
As soon as you see that there is anything that is wrong, or you need to be accountable to that. You need to own it as well, and the team will support you with that. It's better to say then and there rather than wait until the damage sort of dominoed.
Yes,
already.
And then after how many days, years has passed, and then they will find out, and then...
Correct. You need to own your experience and need to be accountable for your action. Yeah.
Yes. So one tip is that, as you can see, as John's answered my questions, or question, he is giving us an example right away, right? So that the employer would be, would know that he really knows what he's doing. Kasi di ba binibigay mo agad yung example eh. Kasi kung sabi ka lang accountable nurse, tas inano mo lang yung tawag dito, dinefine mo lang yung what's accountability. Well, wala lang yun. Pero when you connect it with your experience,
presented with the situation.
Yes, presented with the situation, that's a plus point again. Diba? Very good.
And that's what you're looking for. You need to be more personal with this question rather than resorting into a wishy-washy answer, definition, and not directing it to the point. It's better to answer a question with experience.
Experience, explanation. Yes. Okay. Next question. Why are you interested in working in this hospital?
Can I say something about that? Like, you need to say a lot of positivity in a hospital. That's a plus point. Okay.
Correct.
So, and in answering that question, I work in this institution because I know that this institution provides, for example, in my role, provides a coronary angiogram, coronary angioplasty to patient, and this hospital is so big, and I know that this hospital can support my further education and can even hone my skills, and wherein this hospital can provide me growth professionally and in building my career.
Perfection! Ganun din yung answer ko, copy-paste. Yeah, that's a good answer. Oo. Dapat you would build up as well the hospital na this hospital will help me to grow professionally. I will acquire more experience in this hospital because you are doing lots of different specialties. Ganun! O, diba?
That is correct.
Next question. What can you contribute in this job?
Yes, that's a very good. Yeah, that's a very good question actually. With my skills and knowledge with cardiac, I know that I'll be able to help the lab with cases and procedures that we do here, and because of my specialty in TAVI, I don't need further training, and I can mainly swim in the ocean and be in a procedure to do cases.
Swim in the ocean, sabihin niyo yun sa interview niya, I can directly swim in the ocean. Gusto ko yun. Ibig sabihin, hindi niyo kailangan turuan. Alam ko ang ginagawa ko. Diba?
Well, that is when you have the skills.
Yes, but
yeah,
if you don't have, don't say that.
Don't say that. You can say that you can be trained. You are highly trainable.
Yes.
Yeah.
And also, since you are well experienced, just say, I can teach the younger staff or the newbies or the novice in the area. I can with the length of my experience that's very, very long.
Or if you don't have experience, you can say that at the moment I don't have the experience for the position, but I am 100% committed to be trained.
Yes.
Yeah.
And you are also more than welcome to share your knowledge.
That's right.
That's what can you contribute in that particular job.
Yeah.
Being a well-experienced nurse.
Being a well-experienced nurse.
So those are the most common questions for our first stage, which is basically selling yourself. Now let's go to the second stage, which is
clinical questions and how you respond to those clinical situation being a clinician.
Okay, so since our audience are not only Scrum Scout, we have anesthetics and PACU staff nurses as well. So let's go, for example, to PACU.
PACU, yes.
Recovery.
Yeah.
Okay, one scenario is that, for example, you have a patient post-angiogram and then your patient is having hypotension. What will you do?
So, if I'm in a PACU, managing that patient having a hypertension post-coronary angiogram, the first thing that comes in my mind would be this patient is bleeding, okay, and you need to find the source of bleeding. If, for example, the entry of the procedure is the femoral artery, then you have to look whether this patient still have the sheath and the sheath removed, whether there's any bleeding on the site of puncture. And having all your clinical knowledge, you need to know like what's the ECG currently in the patient. Is there any disruption in electrical conduction in recovery? So hypertension, and for example, the sheath is already out, and there might be hematoma formation. That can cause hypertension. And the other thing is that if there is no hematoma, is this patient having retroperitoneal bleed? So it's not only hypertension that you look at this time. You have to assess everything. What is the mentation of the patient, the current status of the heart rate, which is said ECG, because one of the causes of hypertension could be a vasovagal, when you're having hypertension and bradycardia, the classic vasovagal. Into that matter, this will assess your clinical skills basically as a clinician, because then the interviewer will say, oh, he knows something about that.
First thing, assessment.
Assessment.
Then after that,
and
referring
or manage. Assessment, if you can manage it. Manage it. If you can't, always call for help, which is the medical.
And then
medical emergencies.
Wait for the doctor's order, and then yun na.
That's correct. And then you manage the problem.
Just na-manage mo na yung problem. Oh, yun na,
So
okay?
that's one of the clinical questions. So clinical questions depends on the area that you're applying to.
True. Next question for the Scrub Scout naman, clinical-wise. For example, you lost a needle and then it's a 4O Prolene needle. So it's big enough for the x-ray to...
4O Prolene needle.
Yes, 4O Prolene needle.
Yeah.
You lost the 4O Prolene needle and you found out while you're doing your first count. What will you do?
So this is a miscount already because you can't close a cavity with a miscalculated, miscount. We call it a miscount. So you need to inform the surgeon already.
Right away?
Yeah, right away. Yeah. It needs to be corrected, needs to be counted correctly. If you can't find it, then what is needed, because you can't close that cavity yet, what is needed is that an X-ray will be performed to the patient, and if it's not yet found, and the next stage would be you need to do a risk management of the case. So it can be escalated. So
inform also your floor coordinator.
And the floor coordinator needs to be informed with the matter as well.
Yan. So yung mga hanapin nila dyan, ha? First, inform the surgeon. Ayan. Don't let the surgeon close the cavity. Explore. Let the surgeon explore the surgical site. And then, your scout nurse, let them find the needle on the ground, wherever in the rubbish, anywhere. And then, if you can't find the needle, call for the x-ray. Then the x-ray will be coming. If, for example, they found the needle, then the surgeon will have to explore again and find that needle. If, for example, that needle wasn't found, even if you had the x-ray, meaning it's not in the patient. So that's the safe side. Safe side. The needle is not with the patient. Now you have to do still the risk man. Inform the floor coordinator, and then you write it in your documentation that you have an incorrect count. Do not write correct even if it's incorrect.
So this is telling the viewers that this is going to be the answer.
Yes, this is the answer.
That's the answer. So you're giving it away, isn't it?
Correct. Giving it away. For free. Subscribe because I've gave it away, the answer for free.
For free,
Okay, next clinical question. What is the importance of timeout?
Timeout is part of the standard of care here in Australia. And I actually do the quality of that. I make certain that timeout is practiced in the department. So it has 3 stages. The sign in, the timeout before you start a procedure, and the sign out when you are closing the case. So timeout is highly important because then you know that you are doing a procedure to the right patient, and it's also important because then you will know the team members. It involves team introduction. For example, in timeout you see and everyone is foreign to each other. You will say, like you declare the patient name, and then the patient's got 3 identifiers, being the name, the date of birth, and there's a hospital unique number to the patient, and then the procedure that's going to be performed, and the consent, and making certain that the consent is correct, and it's the right, for example, it's the right organ that you are explanting, yes, or it's not, or it's the right knee that you will be amputating, and it also involves checking the allergies of the patients. It's basically a sheet that will tell you that this is the correct procedure, correct patient. And the sign out would be correct procedure, whether the count is also correct, and any further, where the orders written, like the doctor's order written.
Any specimen?
Yes, that's part of the sign out.
Failure of any equipment, that's part of your sign out.
Sign out.
So it means that by doing the timeout, you are performing the correct
procedure, the correct patient,
and also
and the correct team.
correct team.
Yeah, but Spark, the team is there. Yeah.
Yes. And make sure, just say it in your interview what's the importance of timeout. Siyempre, I will make sure that everybody's listening when or participating when the timeout's being done, especially the surgeon. As you have said, you are the patient's advocate. So
you are the patient advocate. Yeah.
Push mo yan. Dapat, even if maybe the interviewer will ask, what if your surgeon doesn't want to do the timeout? What can you do?
You have to do timeout.
Yes. And insist.
That is imperative.
So I think that's enough for our second stage questions. Now let's go to the third stage, which is...
The third stage is working in a team, being a team player.
All right. So first question for being a team player, how do you manage a conflict?
Managing a conflict between colleagues. For example, if I don't like what I saw in the performance of a colleague, which is probably wrong into my mind, then I would tell that person straight away, rather than going into the manager straight away, for example.
Yeah, so always tell the interviewer that you are willing to manage the conflict between you and your colleague professionally. In a good way. Yeah, laging meron dapat professionally in a good way. Another question, for example, with a grumpy surgeon, how do you manage grumpy surgeons?
The grumpy surgeon, well, I don't need to manage grumpy surgeon basically, because I've got the skills that is needed for the job, and that is what's needed for the job. If we're doing a coronary angiogram or coronary angioplasty, I know that I can perform the procedure safely. So at that time, I don't need to manage with their attitude, but because I have the skills and knowledge on the procedure, I'll do the procedure itself and not managing their attitudes.
Meaning, John will not let the surgeon to be grumpy. Because he knows what he's doing.
Correct. Because you know what you're doing, and it's not part of your job to tame them.
Yes.
Yeah. What we are looking for is...
Gusto ko yung answer na yan. It's not part of my job to tame them. I just have to do my job correctly.
To do your job correctly. And that's what you are applying for. And that's what you are there for.
Oh, ganda yung sagot niya. Copyin niyo na lang, copy-paste.
Yeah.
Okay, next question. Have you ever been a part of a quality improvement project? Laging tinatanong yan.
That is my job.
Oh, yeah.
Being a clinical nurse specialist, I monitor the quality and standard of care in the cardiac cath lab. So from the surgical timeout, that I've said, to surgical scrubbing, so all those standards are part of the quality that I am auditing. So if for example, the standard is not met, then I generate a report, and that report will be submitted to the manager, and the manager can bring it back to me, and then I would do some recommendation on how to improve the quality and the standard of care. But if you're not part of the quality project, you can say that you are an active team player of the quality improvement in the hospital. You participate well on the hand hygiene, or the surgical timeout, or the line labeling, being an active participant of the quality and standard of care.
Yeah. So you don't have to be, you don't have to be a part of a quality improvement team to tell them that I've been part of this team, but you were not part of that team. You just tell that you are observing and you are actively involved in this hand hygiene, infection control. You are applying it in your job. Yeah,
that's correct.
Next question: can you think of a time where you displayed a good teamwork?
Yes, all the time in a perioperative environment, because in a perioperative environment there's always a team. You have the surgeon, the scrub scout, the radiographer, the anaesthetist, the anesthetic nurse. So they assume specialized roles in each position, and you need to be a team player to be able to do a procedure. Without one, it would be hard to do a procedure. Like I imagine a procedure without scrub scout, and it's mainly the surgeon and the anesthetist. It would be extremely difficult, and basically you have to cancel case in those situations if you don't have surgical scrub scout nurses. So there is this situation that we were called in the middle of the night, and of course the team were called, the surgeon, the scrub scout nurse, the radiographer and the cardiac tech. So in those situations you can't just say that this is my line of work. I don't do that kind of work. So mainly to start a case, whatever you can prepare before the procedure starts, you have to prepare if you're the one who gets in first. For example, you know that you're going to be scrubbing. Oh, I am only going to do the scrub roll and not worry about the scout roll. So what I did at that time is prepare everything, like get a line and prepare an intravenous line, get all the equipment that's going to be needed during the procedure, because I was first to attend to the situation. And then because this is all a matter of time, and being a team player, it's not only your role, but you assume other roles as well.
Correct.
For the case to be managed well.
Very well said. Because there's no surgery that is successful without the whole team. So that's a good answer.
Good answer.
That's a good answer because John managed to give an example, being called in the middle of the night, and he's the first one who arrived in that place. And then what he did is that he prepared everything he can while the team members are not yet in there. So it means he's a good team player. He's not selfish. Okay?
That's one way to answer.
Next question. Would you work better as an independent worker or a team player?
You've got your register. I am a registered nurse, and I'm a registered nurse for a reason, and that is my independency. But also working in a team environment. So being that, I work in a team, within a team, performing my role within a team, but also I work as an independent. For example, doing a case, doing a coronary angiogram, if I'm injecting a coronary artery. And so being in that team, I am the scrub nurse, okay? And for example, I saw that during the injection of the right coronary artery, there is a dampening in the pressure. I will not be injecting in a dampened ACJ or dampened waveform, injecting on the right coronary artery, and that's my independent thinking. So I work within the perioperative team, and also I've got my license as an independent nurse and working. That's my independency. See what I mean? You work in a team, but you apply your,
Kita niya siguro blackface na si Bakda kasi bababa na yung dugo ko, wala na ako naintindihan.
But you know, you are a registered nurse that you're not going to. You have your independent thinking.
Yes.
Yeah, you have your independent.
So for example, I'm a scrub nurse. I will not just depend on my scout nurse on what she will open, like what instruments will she open for me. Right. I should know. I should be the one who will tell her, I need this, I need that. As a scrub nurse, for example, as an RN, I should know what I'm doing. But aside from being an independent nurse, because I know what I'm doing, I should also communicate with
work with a team.
Yes, with my teammates, because I'm a team player as well. So
an independent and a team
we can
player.
both be an independent and a team player. It depends on the situation. Okay, next question. What will you do if your list overrun?
If I know that the list is going to overrun, generally I'm more than willing to stay back and finish the list. But if not, then I have to inform the floor coordinator an hour before the list concludes. so that they can find a substitute for me to finish the list.
Yes. So that only means that you are an organized person.
Correct.
Yes. You know if the list will overrun. You know if the list will finish early.
So as a Scrub Scout, you can foresee whether you're going to overrun your list or not, and it's also your responsibility to tell the floor coordinator if you're going to overrun the list.
Yeah, because normally
a perioperative.
Yes, because
surgical
normally you
environment.
know how
Yeah.
the surgeon works, how the surgeon manage this kind of procedure. Yeah, there are surgeons that are quick with this kind of procedure. There are surgeons that are really slow. So you know how to judge.
You know how to judge.
Yes. So there you have it, guys. So those are the common questions being asked. And now we will give you some tips.
You need to at least prepare
Yeah.
Be yourself.
Presentable.
Be presentable, yeah, and in that situation. And when you are being interviewed, the tips is wear something nice, really.
Wear something nice.
Wear something nice. Don't wear scrub suit during an interview. That, for example, you're being interviewed in a perioperative environment and you wear a scrub suit. No, that is a no.
Yes.
You need to be at least wear semi-formal attire, formal attire at least, to make yourself presentable. Yeah, presentable during the interview, and don't arrive during the interview sweaty and gunky feeling.
Arrive on time.
Arrive on time. Yeah, not too
early.
Not too early.
Because they are really busy,
Yeah,
right?
correct.
Yeah. For example, your managers are in scrubs and they're all running around in the theater. They are busy, so don't disturb them. Just arrive just on time, or 5 minutes, 10 minutes before the time, 1 hour.
Yeah. So prepare yourself. For example, you know for a fact that you will be asked about describing yourself. So practice. Yeah.
Yes.
Describe yourself on your own in the mirror.
Yeah. I do
That's
that.
it.
I usually ask myself with these questions, and then I'll answer, and then or your husband, your friend, just ask them, and then you can record it and then hear it again. Do I sound nice or not?
Yes.
Diba?
Correct.
Okay, for the adjectives.
For the adjectives,
you should be a good team player. Adjectives talaga. Good team player.
Yeah, good team player.
Accountable.
Accountability. Yes. Willing to be trained.
Willing to be trained. Yes.
Yeah, willing to be trained is really important. I think that is the answer that I remember when I enter cath lab. I don't have an experience, but I said to them 100% committed. Committed is the other one.
Committed is the other one, yeah.
Committed and willing to be trained.
And if you are a well-experienced one, I'm willing to share my knowledge. Yan.
What they can get out of you.
Yes. And then, of course, time management. Because you're a Scrub Scout and we have, long lists sometimes. How would you manage your time? By being organized. Putting things into proper places, like getting all the equipment, all the machines and consumables right on time or before the start of your shift.
So mainly to increase your turnover.
Yes. Because if you are not ready, that's the time that the turnover is very slow. So time management, just tell them, and I make sure that at the start of my shift, everything that I will be needed for the whole list will be available at the start.
Efficient, related to time management, which we have discussed before.
Yes, okay.
Facilitating turnover.
True.
Facilitate the production as well.
Yes, and then you are also a productive staff.
Yeah, productive.
Yes.
And of course, don't forget about your skills.
Yes, your experience.
Experience.
So again, ayan, thank you so much, John, for that fruitful conversation. Diba? I hope marami kayong natutunan, guys. And don't worry, maybe these questions will help you to get a job one day, diba? In the perioperative area. So we're not saying that the answers that we have given you are the correct answers. These are just based on our experience and how we deal with these questions. And these questions are just common based on our experiences as well. We're not saying that these questions will always be asked whenever you'll have an interview. But for me, these are the questions that I've been asked to John as well and to other friends. Actually, I've asked some of our friends in the perioperative area. And then,
What were the questions asked?
Yes, and then I just collected them and then now we made this vlog. Again, thank you, John, of course.
It's always a pleasure.
Yes, ayan. Kasi kailangan ko kasi yung English niya, guys. Siyempre, para naman may idea kayo paano mag-English. Wow, English! Kasi ako hirap na eh. Ayan. Again, of course, thank you so much, guys. Don't forget to
Like,
subscribe, and hit the notification bell for future videos. Again, this is Angel of Team Zulueta. Till next time, you can write your comment or your suggestions about nursing career per se. Ayan, then we will do our best to make a good content para sa inyo. Because this one, John, for your information, was just a comment in the comment section of one of the followers. So, diba? They suggested, can you do this content na about common questions being asked? Yes, so your wish is my command. Kaya comment down, ayan. Don't forget to share as well. Thank you. This is Team Zulwera. Bye!